Hey guys, I want to talk about the decisions we make when we're going through our careers, and all of us have been. We've been through elementary school, we've been through middle school, we've been through high school, dental school, now oral surgery training. It's just we always have these milestones that we're hitting, and we put a lot of investment in ourselves. So now we come to this decision of owner versus employee, and I've done it for long enough where I was fortunate enough to go right and become an owner as soon as possible. But there was risk, reward, autonomy. There's three things that we have to consider, and they're all very personal. Like someone's risk for me isn't as great for someone else. Like potential for professional and personal failure. Like what have we ever really failed on in our lives? I mean, we made some maybe bad decisions, but in all honesty, there's only so many people that have gotten to the position that we've gotten to in our lives. So the risk of us not being able to be a good doctor at this point, I think would have been weeded out a long time ago, or a good person. But the risk of failure, that's always going to be kind of weighing on us. There's different layers of what we consider failure. From a professional standpoint, if we risk financially opening up our own practice versus we risk financially not opening up our own practice and not having a nest egg at the end of the rainbow, then that's a risk in itself. So it's a kind of a dichotomy what we're looking for. The reward, potential financial upside over time. There's a lot to consider these days that weren't around when I was there. And autonomy. There's autonomy at home and autonomy in the practice. If you go and you join and become an employee, you have plenty of autonomy at home that no one's going to be bothering you with questions and concerns. The bank's not going to be calling you and things along those lines. But then there's the autonomy of owning your own practice where you can make that whatever you want. Let's go to the next slide. This is this was done by the ADA last year, and it talks about what the overall environment out there looks like. Kind of in a nutshell, the dark green are pretty much privately owned practices, single doc, double doc kind of owned practices. The gray or the corporate, like the Aspirins, the Clear Choice, and things along those lines. So up to 10 years out, those are the newbie dentists that are coming out. A lot of them have a lot of financial debt. And so their risk of opening up their own practice, they don't want to come and pile on that debt. So a lot of them are going towards that corporate identity. The other one would be looking at the other end. That first column is the average of all the dentists out there. The second column are the up to 10 years. I'm all the way on the fourth column, all the way on the end, more than 25 years out of dental school, which is happening this year, which is kind of sad. But back then, we didn't have all the opportunities. I think aspirin was a new concept out there. There were some corporate dental clinics out there, but there weren't any real DSOs. So that's a whole new thing that's come around in the last 5 years that we have to consider. I'm sure 10 years from now, that gray portion from the patients who are more than 25, I mean, those doctors are more than 25 years out, is going to grow quite considerably. But that doesn't necessarily mean that if you're in the gray 10 years out, you're not going to be in the green 25 years out. So I've done this plenty of years where I've had associates come to me 5 years out after being out of the residency programs or out of dental school and coming to us and saying, all right, now I'm ready to open up my own practice. And some people need a little bit more of like coddling and comfort, and a little bit, as we all know, residency is a far cry from private practice. Dave and I aren't doing gunshot wounds to the heads anymore. We stopped doing orthodontics. Thank you, Mike. You can take all of them. We stopped doing orthodontics like 5 years ago. So Connor, that doesn't mean you can't do them right when you get out. And you may feel more comfortable showing, like having a veteran doctor show you the way. Let's go to the next slide. And so this is if you come out and you're employed. So a lot of the new oral surgeons and stuff are coming out there, and they're going to be like, all right, let me join someone. Let me learn how to be a private practitioner. I know how to do all the residency. I know how to admit, discharge a patient. I know all the trauma. I know all the pathology. But how do I treat a staff member? How do I do all that kind of stuff? So this may be a good starting point for a lot of young docs where the risk is moderately low. I am joining, I'm getting a paycheck. All right. So the reward's not going to be that great unless they make me a partner right away and I can see kind of a little bit more of a growth potential. But my autonomy in the office is going to be pretty kind of boxed in. This is your job. This is when you have to show up. This is how you treat. There's going to be, this is the production we're expecting from you each month. It's going to grow a certain amount. So if you want to go out and you want to go fishing for 2 weeks out of the year straight, that's not going to happen. That's something, if you're a private practitioner, you can kind of bake into your practice. But being employed is less risk per se, and it may be a time frame. So like Mike, when you came out, you became an associate. Connor, same kind of thing. That is not a bad thing. Okay, that's a learning thing, and you can grow from that. But at the end of the day, you may say, is it worth it for me in the long run to stay in this position? And if we go to the next slide, this is like the second kind of thing you can do. That's that not dark green, but that mildly green one where you have a practice of like eight surgeons or 8 dentists, and you're coming in and you're buying into that practice. And it's no longer that 4-year span like middle school, high school, dental school, residency, where you're going to elevate throughout those years. And all of a sudden you're going to become the chief resident. You have to wait for either one of those people to retire or to die, and then you become a little bit more elevated. And then your autonomy, you're going to be one voice in a bunch of other voices who've been there for a while. So, and I'm sure knowing our professions, there's going to be a lot of alphas out there, and to try and to raise to that level may be a little bit more difficult. So the third option would be to buy your own practice and start out. So I just saw Brittany just joined us. So in terms of like in general dentistry, you can buy a practice, and there's a lot of worth to that, because 2/3 of those patients are going to stick around no matter what. Okay, there's a I guess it shows that there's a 30% attrition rate if you buy a practice, and that's an average. A lot of people do stay. It depends on geography. That's everything across the country. So I think in a more like rural area like New Hampshire, you get a lot more retention of patients than you do, say, in like New York City or Boston, where there's a lot more saturation. From an oral surgeon standpoint or a specialty standpoint, if you're going to buy a practice and that head older guru takes off right away, all the goodwill goes out the door. So you're stuck there with machinery and equipment that was bought 10, 20, 30 years ago. And the goodwill you have just went to Tahiti. So that's not a good situation. That was the old school. Now you have these DSOs coming in, and they're buying some of the practices, and there's a lot more retention. You're not just kind of sitting there on your own. There's a lot of support, like Dave and Amy were saying, but the autonomy over time will be a little bit more constricted. So like when I started out on my own, I was working 24/7 to try and get the practice going. There was a lot of risk involved in terms of that, but I knew I never failed in anything. I may have failed one spelling test in my life, but that was about it. But I knew as long as I had faith in myself, and we learned along the way, and this is what we created this smart choice about, of not to fall in the ruts that I did. We learn from those mistakes, and we make sure that you guys do not go in that situation whatsoever. So now I maximize my autonomy. I built up my equity. This is the difference. So dental service organizations are good. They serve their purpose. They give you comfort. They can kind of teach you things, essentially how to run your practice that you may not know of. All those things, those pluses and minuses that Dave talked about, they're overwhelming. That's why we created this. If we wanted to open our own practice, we wanted to make sure you knew how to do it. And then Practice Primer, it talks about how to get the money, how to get the insurance, how to retain legal counsel, things along those lines. So the dental service organizations are good, but they're not absolutely necessary. Back when we opened up in 2005, what took us like one step then takes us about 4 steps now. So I don't think I would have been able to do it autonomously on my own. And that's why we created this whole program. The other thing to think about too is there's equity growth. So if you're just an employee or an associate your whole life, you're getting a good paycheck, you may get a good bonus system, but you're not really developing any equity. So what is the biggest thing in everyone's life, regardless of your profession? What's the big thing that holds the most equity in most people's lives? Your house, right? So think of the practice as your house. Like my house, I bought it in 2007. It's quadrupled in price, okay? You can apply that to your practice too, as long as you stay current and you don't have ashtrays and wood paneling on the walls and you're staying up to date with all the technology. Your practice can grow that way too. And Dave's going to get into that right now in the next slide.